Perfect. So we're gonna measure, do a test that is called diaphragmatic excursion. What I'm gonna tell you, Carlos, I'm gonna start percussing again. You're gonna inhale, and once I tell you to exhale, you're gonna exhale. So I'm gonna percuss until I hear a dull, until the resonance stop, and then I'm gonna percuss again back until the dullness and the resonance kind of meet. So that gap in between the two sounds is gonna tell me how much is the diaphragmatic excursion, and I'm gonna do it on both sides. I'm just gonna do it on one today for the test. And normal diaphragmatic excursion should be between 3 to 5 centimeters. So go ahead and take a big breath and hold it. Okay, so my sound change here. You can exhale now. And I'm gonna mark the area. So we're gonna do the same thing. I'm just gonna come from your lower back, okay? Perfect. So I have my two marks where I hear my dull and where my resonance finish. And it's kind of like 6 to 7, and it's kind of normal to go above 3 to 5 when there's a younger patient or their athlete. I'm gonna check for your lung expansions now. So what I'm gonna do, I'm gonna place my fingers like kind of close to your spine, and I'm gonna tell you to inhale and exhale. Inhale and exhale. So what it does, the movement of my hands, when he inhaled, my fingers should come towards the middle, and then when he exhaled, should kind of go back, and that's telling me he does have a good lung expansion. So now I'm gonna listen for lung sounds. For lung sounds, I'm gonna listen on the anterior wall, which I did check. Like I said before, I checked for his skin. Everything looks fine. I palpate, there's no masses. Female patients or male patients with large breast, you want to kind of touch his breast area just to kind of feel for any masses, lumps, or anything abnormal. So I'm just gonna go ahead and listen to your front. Go ahead and breathe normal for me all the time. And I'm gonna start just right below the scapula where the apex of the lungs are. Go ahead. Perfect. Good. We're gonna do the same on the back, okay? Big breath. Okay, and respirations are on labor, and I don't hear any adventitious sounds. There's no wheezing, rhonchi, crackles, none of that. While I'm here on his back, I'm gonna check for your kidneys. I'm gonna do a little tapping on your back, and you're gonna tell me if you feel any pain. Patients that do not have any kidney problems, that says CVA tenderness, that's what I'm gonna check for. You should not feel any pain when I'm tapping. And it's at the level of the costovertebral portion of your back where you will feel that. So you let me know if this is painful. Is it painful? Okay, so I did check for CVA tenderness and it's negative. I'm gonna go ahead and listen to your heart. So for that, I did check previously his carotid pulses. I'm gonna check pulses on the anterior of the upper extremities. They're bounding and +3, and I can feel them. So now I'm gonna assess for lung sounds, and I'm gonna start listening to your valves. So I'm gonna listen on your right side for your aortic, pulmonic. We're gonna do tricuspid, which is in the air point, air sign, and then mitral valve. Mitral valve, it's on 5th intercostal mid clavicular line, and that's also where you can hear for the maximum pull impulse for the PMI. So I'm gonna listen with the diaphragm and the bell of my stethoscope. What I'm doing with that, I'm gonna listen in for high and low pitches sounds. All right, you can breathe normal. Aortic, the pulmonic valve, tricuspid, and mitral. You can kind of trace the line under the nipple, fifth intercostal space. And I'm gonna do the same thing with the bell of my stethoscope. And I'm gonna listen on the apex for a full minute, which I'm not gonna do it, but I can hear his S1 and S2. There's no extra heart sounds. His rhythm is normal, and that is with the cardiovascular. Since we're here, I'm gonna have you kind of put your arms up, and here we're checking for muscular and neuro assessment as well. So we're doing extension, just lower, and we're gonna check for your elbows. So what I want you to do, you're gonna do flexion and extension of both elbows. Just do the other one, and we're gonna do supination, where I want your palm of the hands like this, and then we're gonna do pronation. Perfect. And then you're gonna do abduction and adduction. So I want you to there you go, and then bring it inside, and we're gonna do it with the elbows flexed. Perfect. Good. Perfect. All right. So I'm gonna move on to the GI assessment, and again, what I want for that, I'm just like inspecting the area first, and I see there's no scars, there's no previous surgeries, there's no visible lesions that I will be kind of worried about. I'm gonna have you lay down once I remove all this from here. Okay. So after I inspect the abdominal area, I want to listen for vowel sounds, and I should be listening at least for 15 minutes on each quadrant. So I'm going to start on his right lower quadrant and make my way to the other area. Okay, and vowel sounds are active in four quadrants. Now, since I'm listening, I'm going to listen for his abdominal arteries. So I'm gonna start with the aorta, which is like 2 fingers above the umbilical area. I'm gonna listen the valve, then I'm gonna do renal arteries, aortic artery. I'm gonna listen for renal arteries, which are on the upper bilaterally to the umbilicus. The iliac arteries are a little lower here, and then the femorals are like down here. So I'm just gonna go ahead and listen, and when I'm gonna be looking for any bruits or trios, that will tell me that it's an aneurysm or a stenosis on the other arteries. And I'm gonna do that with my bell.